Hi Emma and Co. I hope this presentation finds you well. I hope you find it interesting and slightly different. As you may guess from the title, I've looked at workplace ergonomics in the oil and gas industry. The reason being, well, I work for a large global insurer whereby I case manage a somewhat diverse MSK caseload for some of our corporate clients. Now, one of these clients is a multinational oil and gas services company. I just wanted to better understand some of the claimants' working environment, so I hope you enjoy it. Okay, so introduction. Employee requirements in the oil and gas industry have been labelled as amongst the harshest and most stressful work conditions in the world. The industry consists of numerous inbuilt environmental health and safety risk factors now. Such risk factors include production procedures, heat, noise, vessel motion, vibration, harmful chemicals and labour-intensive work. Now, if the appropriate human factors have not been considered or found to be deficient in the above, then workers will invariably be susceptible to ergonomic injury. So, moving on to ergonomics defined. Ergonomics concerns the understanding of the interactions amongst humans and elements of the system. Now, its application to industry is not only an approach to value creation, but is also a legal obligation. In the resourceful and safety-conscious oil and gas industry, ergonomics is used to safeguard designs, leading customarily to enhanced user proficiency and safety. Now, some conceptions which support health and well-being in the industry. Now, all companies within the oil and gas industry have an obligation to protect and support the health of those affected by the multivarious operations involved within the industry. Now, routinely this is achieved through the adoption and implementation of an occupational health management system. Now, an effective, successful occupational management system typically includes the requirements on establishment and support for a policy, the communication of a policy and other principle requirements. Now, the International Association of Oil and Gas Producers cites the following key aspects of any occupational health management system. So, health risk assessment and planning, health reporting and record management, medical emergency management, management of ill health in the workplace, and occupational hygiene and control of workplace exposures. Notice that's highlighted because it does house ergonomics, which we'll talk about in the next couple of slides. Now, workplace exposures, some relevant ones being chemical, fumes, mist, gases, smoke, biological, physical, psychological, and ergonomics, which is the centerpiece of this presentation, which we're going to go on in a bit more detail now. So, some risk factors and how we kind of categorise these. As we mentioned previously, numerous inbuilt human risk factors. These can be categorised in the following biopsychosocial format: physical musculoskeletal ergonomics, cognitive ergonomics, and social or organisational ergonomics. And we'll speak about each one in detail over the next couple of slides. So, physical ergonomics, interesting image here, and we'll talk about it in detail in a moment. We'll just define it first. So, physical human factors concern the anatomical, anthropometric, physiological and biomechanical characteristics which relate to physical activity. Now, a great example in relation to the anthropometrics is the image in this slide, whereby we can see a female kind of struggling to reach the apparatus. Now, apart from the obvious gender differences between males and females in kind of height and weight and so on, there are also subtle differences between kind of demographic populations as well. So, for example, Caucasian males from America and Europe tend to be taller than their counterparts from East Asia. This is particularly important consideration for those involved in human factors in the industry, due to the fact that oil and gas is kind of a global industry. So that's kind of in relation to physical ergonomics. Now, other examples kind of include kind of access to valves, space and congestion as well, design of stair and passageways, and manual handling tasks. And we'll look at these kind of on the next slide. So here we have the issue of kind of alternate and in conjunction with kind of space congestion. Now, this is a bit of an issue because we're at risk of kind of trauma to hands, in particular dorsal aspects of the fingers and knuckles. We've got issues in terms of kind of trip hazards here with the kind of gas pipes or oil pipes here. We've also got kind of these protruding areas here. Notice the railing here, and then we've got this middle section which kind of protrudes over. If we look kind of down this line here, it kind of exceeds, if you know what I mean. And now if this individual's to walk at pace, there could be a risk of kind of lacerations here. Here we've got an individual kind of a bit of unusual behaviour in climbing to kind of reach some kind of safety gauge on here. Now, if this is slippery, if this is wet, sorry, there is an issue of kind of tripping and so on. Now, it's kind of poor design. All of these slides kind of highlight that. So that's kind of physical ergonomics. Cognitive ergonomics, defined, focus on the fit between human perception and limitation, and the associated environmental tasks and requirements. Now, some examples include the design of graphical operating interfaces. Now, incidentally, poor design may result in decreased production on these platforms and increased life-threatening incidences. What we have here is kind of a control group, before and after kind of implementation of ergonomics. A bit of decluttering involved in this slide, which kind of maximises the space for those involved in the cognitive sense of ergonomics. Now, organisational ergonomics, kind of define that first, concerns the augmentation of socio-technical systems which extend to organisational configurations, policies and procedures. Examples include human engagements during irregular circumstances such as emergency egress planning. Now, moving on to some kind of brief recommendations. Examples of ergonomic solutions pertinent to the oil and gas industry include workplace design following ergonomic specs, acts and guidelines for the used population. Employees, including non-operational staff, i.e. managers, need to be trained systematically in human factors in order to improve kind of occupational health and safety, which leads to kind of improved human performance. Number 3, implementation of written policy must be ensured through thorough inspection. Additionally, all signage kind of on platforms and on these rigs should be placed in strategic view, and also the use of larger fonts kind of being employed, considering both direct and non-direct glare. And we also have strategies should be formulated in order to improve work health, which we'll talk about in more detail over the next, towards the latter part of the presentation. Now, in terms of the relationship between the worker and their environment, we have the person-environment fit. Now, the principal hypothesis of person-environment fit postulates that a misfit between the individual and their work environment may lead to psychological and behavioural strains. Now, the concept can take one of two forms. We've got supply-value fit, which involves rewards, i.e. pay, praise, etc. And we also have the demand-ability fit, which relates to kind of demands and requirements of the surroundings, which complement the skills and capabilities of the individual. And this is more kind of towards ergonomics and the relationship from that perspective. Now, additionally, we also have kind of the issue of job control as well, being a contributor. So a lack of job control has been established to be one of the main or primary drivers to psychological dysfunction. Strain occurs when work is high in demand and low in control. Now, conversely, obviously, well, more control a person has over their working environment, the less strain one encounters. A bit of a no-brainer, that one. Now, moving on to the strategies itself, we've got 4. Now, by reviewing literature, the main areas for improvement involve, number 1, okay, ergonomic design process and inadequate ergonomic resources and training, poor communication between the various stakeholders, a limitation of strategies for the identification of ergonomic problems in designs, and poor quality control methods in the identification process. So we're going to talk about each one of these on a slide each. So we've got ergonomic design and training. Now, just in terms of design, and this could be addressed by a collaborative effort from both engineers and designers to review and document contemporary design processes for constructive comment. Also, additionally, such professionals should be educated on the elective proposals in order to kind of ensure uniformity as well. So we're all kind of on the same hymn sheet with this one. Now, moving on to training, resources should include kind of text, relevant standards, and access to an ergonomic consultant if possible. Operators should be informed of the accessibility of the above, including instruction on how to use and incorporate ergonomic information. Now, okay, just in relation to PE fit, in terms of training, as well as kind of design. Now, ergonomic training has been shown to reduce perceived uncertainty on ergonomic usage, affording individuals control over kind of task demands and so on. Now, the figure in this slide demonstrates the pertinent relationship between ergonomic design and training and kind of stress as well. Now, both concepts of PE and control fit are applied as the theoretical basis connecting ergonomic design and training with induced strain here. Now the model proposes that both perceptions of PE fit are swayed by human factor design and training, thus the relationship is positive. So obviously these are two kind of important areas. Okay, so moving on to improving communication. Now, relevant case study found communication glitches between three distinct parties: the company, installation contractors, and company operators. Now, the suggestion of company operators being involved in the kick-off meeting was proposed in order to facilitate improved communication. Further proposals involved ergonomists being involved in meetings in order to identify potential safety issues in design specs, and also kind of consulting engineers as well, just in the scenario where design needs some form of kind of modification. Now moving on to the third. Okay, just developing identification process. So an appointment of a resource individual such as an ergonomic consultant. Now invariably their involvement in meetings and hazard and operability studies, bit of a mouthful that word, would facilitate the aim of identifying the applicable standards and specs to the multivarious stages of the design process as well. So additionally, their involvement may also extend to training as well of engineers and designers in particular, in order to promote kind of practical applicability of ergonomic information, such as the use of anthropometrics, as we discussed kind of previously as well. Okay, the last one, improved quality control methods, could be achieved by the use of fault appraisals as the final phase of the design process. Ergonomic sign-offs being employed in checklists as well by engineers and designers. Evaluation of installation, operation and preservation of informatics prior to delivery and setup of apparatus on site. Training and cost estimation as well to ensure adequate budgeting for the inclusion of human factor friendly designs as well. So that's the presentation, just kind of in some conclusion now. Ergonomics in the workplace is a must in order to achieve harmony between the user population and the working environment. It's also a legal requirement in many industries, particularly in the oil and gas industry now. Occupational health management systems support the promotion of health and well-being in the industry. Of noteworthy importance was the control of workplace exposures such as ergonomic risk factors. Now, these can be categorised as physical, cognitive, social or organisational. Person environment fit and job control fit can both lead to psychological strain. The concepts of ergonomic design and training has been shown to positively influence the person environment relationship. So that's the presentation. I hope you enjoyed it. At this point, normally if I present to a crowd, I would open up the floor to questions, but on this occasion we don't have that opportunity, and I'm glad in a sense. So these are the references. And that's it, folks. Thanks for your time and patience, and I hope you enjoyed it, and take care and all the best.